social media, it's a very good landscape to talk about sex.
Yeah. You can do that?
Only gay people get it.
That it's an old person thing. This isn't like a thing that like affects younger generations.
That your life just totally changes.
Sometimes people think that because you're dating a person with HIV, you're also HIV positive.
I have experienced people who are like, oh, can I get it from kissing? And
you did something wrong in order to get HIV. That attaches a lot of shame to your diagnosis, your health condition.
Yeah. So I was working at a hospital in a radiology department, and a colleague of mine took a patient in, and I watched this person put a gown on and double glove and put a mask and goggles, and I said, what are you doing? Oh, you see the little red mark on the paper? I said, yeah. She said, that means the patient has AIDS and you have to be careful. I threw her out of the room, took over, apologized to the patient, and they looked at me and said, I've been in here 10 days. And you're the first person who treated me normally. Thank you so much.
I'm very religious in my church, and when somebody goes, oh, God was punishing you, and I'm like, no, I think he opened opportunities I never would have had before.
Oh my God.
I think you also see it, like, particularly with like the language that people use in everyday conversation, particularly on like hookup apps. Like the number of times that like I've been asked or seen somebody like, I'm clean, or asked like, are you clean?
There is still HIV stigma in the queer community. People who are HIV negative are only wanting to date or hook up with folks who are also HIV negative.
Often the stigma around HIV means people don't feel comfortable disclosing, or they do disclose and then they get a negative reaction and they don't really get the support that they deserve.
Stigmas come from a real place of fear.
Your stigma is not my stigma.
HIV stands for human immunodeficiency virus.
HIV is a viral infection that can be transmitted by blood, semen, or other sexual fluids, and it is a chronic infection. If it's untreated, it can affect the immune system and cause people to be at risk for opportunistic infections or infections that wouldn't otherwise make people sick.
From my infectologist, when I got diagnosed, he told me, well, you have just ruined your life. I was 18-year-old, and I was just like, thank you.
I was really scared, really shocked. I couldn't believe it.
So I got really, really sick. I had a really bad lung infection and everything. This doctor ran into this room and yelled at me and said, I can't believe somebody as sick as you got HIV and you're running around this and that. I'll never forget as they were wheeling me out of this room was, she doesn't know. Don't say anything to her.
I feel devastated. I was just 17 years old in Venezuela, the country where I am from. You know, HIV is completely different situation than in USA.
So my diagnosis story is a little different than most. I do have hemophilia, which is a bleeding disorder. Until recent years, the way it was treated is a medication made from human blood donations. We were called in to Children's Hospital in Boston. That was in 1981 on November 10th. I was one of the first 4 that came back as positive. This is bad, and we have no hope. We had no medications.
The good news is we have really effective treatments these days, and so people living with HIV can have totally normal immune function and really reduce their risks of any complications.
HIV is not about suffering. It's about just getting your pills every day, and that's it, and getting tested and checked regularly.
I think people may have a perception from the 80s or 90s that there's a lot of medications. Nowadays, we have really great options. Most people are able to be treated with 1 or 2 pills that they take every day, and some people are able even to take injectable medications and don't need to take a daily pill. But honestly, the limitation that HIV is going to have on your life is less than many of those other chronic conditions. Yeah.
I can't say that it won't change your life. It will change your life, right? Like, you know, your status will redefine who you are, in a sense, but it won't flip your whole world. I mean, yes, you take some medication, take care of your health, go to doctor's appointments and things like that. But other than that, I live normal life. I'm still this goofy kid who plays video games and talks about dirty things. When I first heard about U equals U, I had no idea what it was. So I had to look it up, and it was just like, undetectable equals untransmittable. And I was like, oh, interesting.
U equals U, so that stands for undetectable equals untransmittable. And so it's a groundbreaking, historic finding that people who are living with HIV who are undetectable cannot transmit HIV to HIV negative partners. And so what does undetectable mean? So undetectable basically means that people living with HIV who start taking HIV treatment or antiretroviral therapy, they should become undetectable. So their viral load, the amount of HIV virus in their bloodstream, should go down.
Nowadays, with the medications we have, people living with HIV live long, healthy lives, and with U equals U, they can have safe sex and they can have great sex.
U equals U is scientifically proven. There were several very large clinical trials which basically followed what we call discordant couples. So one of them was living with HIV and on HIV medication or antiretroviral therapy. And they were followed very closely to see whether or not they would transmit over time, which I think is a really important thing to note in large studies, that we don't notice the transmission from one HIV positive person to the next. So it is absolutely scientifically proven.
I always tell patients is never too late to become undetectable.
It's awesome. I mean, U equals U, and it's just what it says.
U equals U is a very powerful message that can, can make you open up to the world and say, I'm not a threat for anybody. I'm not. Like, you're safe with me.
If we taught people about U equals U, then we'd have less stigma.
When I first heard about U equals U, I didn't connect it to HIV.
I remember when I first heard about that, I didn't believe it. And that's my perception from the old days when we were always told, no matter what you do, there might be a chance.
I'm not gonna lie, one of my brows raised. I was like, that little ounce of suspicion that just like, what do you mean by this?
When I first heard about it, it was exciting. It's almost like a new prevention method as well. People living with HIV can have the opportunity to feel more safe and secure in their intimate relationships with sexual partners.
There's a new way to identify your status, which is not HIV positive or HIV negative, but I'm undetectable.
So it's nice to actually hear myself say it, because I think that once I say it, that I believe it. If we put people on the spot where they have to talk about these things, maybe it becomes more clear to them.
Boston definitely has your back. Boston is providing resources and opportunities for you to take the best care for yourself.
But we're lucky we're up
There's
here.
a lot of good people who have made this area a good place to live with HIV.
We do not turn down anybody in the city of Boston. If you walk into a hospital, no, we will help you.
Whether you're documented or not.
Yep.
Yep.
I never pay for any HIV medications.
For me, I literally cried when they approved me for insurance here. And in my home country, I couldn't afford it. It was too expensive.
So what we do in public health, we really focus in on prevention and outreach to communities and thinking about what's happening at the population level. What I've seen over time is that there's so many people who are at risk and so many people who've died from HIV infection, and it's preventable. We're talking about sexism, we're talking about trauma, we're talking about domestic violence, we're talking about adverse childhood experiences, we're talking about racism, we're talking about not having access to good care, we're talking about challenges with knowledge. We need more doctors who look like me in this space.
Yeah.
Public health, as a field, is about all those supportive services that kind of wrap around a person in order to make sure they're able to want to get medical care.
If you're struggling with finding food, with having a shelter over your head, and just with mental health struggles that are not being met, I think the first thing on your to-do list is not, let me go see my doctor about PrEP.
We have to think about what makes it so people don't get access to treatment and, socioeconomic status and housing and not having childcare and not having transportation to get to appointments. So all of those big social determinants of health, that's the work of public health.
Support groups are the best. You see like-minded people or people in the same situation as you are, and you form a community. You know, you're walking different stories. I have learned 99% of the stuff I know through being part of support groups.
Having more youth centers that are also youth-led is helpful. Having young people teach other young people about this is the best way for them to learn, because there are people who are educating you, but they're also my friends, my peers, sort of thing.
You realize you're not alone.
Yes.
Stop making sex a big deal. It's just sex. To normalize talking about sex is like the first step in being able to normalize talking about HIV.
You get better at the conversation the more times you have the conversation.
If you're engaging in casual sex or if you have a partner, just making that, hey, checking in, and then go on and have a great time.
Treating it just like any other conversation.
Basically, normalizing it.
This doesn't affect just one community. We all have a role to play to keep each other safe and to keep Boston healthy.